Good afternoon. I'm Joe Fetterman with Colliers Real Estate Advisors. Welcome to LabNotes. Today we're here with Nick Pachuda from Peptilogics. And Nick, we're delighted to have you with us this afternoon.
Yeah, thanks, Joe. It's a real pleasure. Happy to share a little bit of what's going on with myself and Peptilogics.
So you have an interesting story. I'd like to dive into it, but among other things, you're a surgeon who found his way into the life sciences world. That's not an everyday story. Tell us how this all unfolded.
Yeah, I was a surgeon for 10 years, focused in foot and ankle, did an orthopedic trauma fellowship, and felt that I was always looking for the next new innovation. And I started consulting for a company and ultimately convinced them that I think there's an opportunity to grow. And me and a few other surgeons helped advise, and I ultimately sold my practice and went to work for that company, built up an extremities business. And from that success, I was able to go on to another startup, a mid-cap, and then ultimately joined Synthes here in Westchester, Pennsylvania, to drive marketing and business development and new ventures for the trauma business. Shortly after I joined, J&J came and made the acquisition and merged DePuy and Synthes together to create the largest orthopedic device company in the world. My opportunity with J&J really was about driving external innovation for orthopedics. And that was innovation strategy, where do we want to be over the long term, and then building a portfolio of partnerships with early stage companies, whether they were at the incubation stage, developmental collaborations, and working with JJDC Ventures for equity investments and more long-term partnerships.
Well, and the innovation theme is a great one to pick up on, Nick, because a next stage in your activity brought you down to the Pennovation campus and in serious involvement with the creation of the JPOD project down at Pennovation. Let's talk about that a little bit and the whole idea of an innovation culture here in Philadelphia.
Well, I mean, I think Philly has almost all of the essential elements for a successful life science innovation ecosystem. It's trending in the right direction. I think it's at the top of the emerging tier, if you will, with all of the academic investment and commercial executive leaders and entrepreneurs available. I still think there's a little bit of a challenge is there enough of a momentum to keep an entrepreneur and a serial entrepreneur, to have them create a business in Philly, get invested in Philly, and stay? And is their next gig right around the corner where they can recycle and repeat? Or are they a flight risk based on who's on their board, or where their funding is coming from? Do they get a pull to leave the region? And I think Philly, especially on post-COVID side, is going to be a hotspot for potential up-and-coming innovation on the eastern half of the United States. And I think Pennsylvania as a state, with the opportunities out of Pittsburgh, Carnegie Mellon, University of Pittsburgh, the AI and robotics and biotech community that's growing there. I think not only Philly, but Pennsylvania is driving regional innovation. And I think Philly has a real opportunity. And if you look at the infrastructure that's in place in Philly to support innovation, the Science Center, University City, and Pennovation, and where I had my particular experience was at the Pennovation Center and helping formulate and work with a team that brought JPOD to life. JPOD has about 20 companies. They filled that cohort. It was well oversubscribed early on. The deal flow, and I had office hours there, was incredible. I was back to back all day long, and so were my colleagues. So I would say, the JPOD partnership with the Pennovation Center not only drove innovation for the University of Pennsylvania, but also Drexel, Penn, Temple, Rothman, et cetera. So the 40% of what I saw came from outside of Penn and the Penn campus. So it was truly, to me, a testament of the momentum that's building in life science and medtech innovation in Philly.
Well, and I think what you were doing there, the contribution that you made has been notable. And when you look at the activity, the fundings, the IPOs, the venture, the private equity that's coming into the region, I think it's palpable. I mean, in our research, we see year over year progress, and with Spark Therapeutics landing and really Roche now being part of the ecosystem, some of those factors that you're talking about, the critical structure to retain these serial entrepreneurs, that's growing. I mean, you guys have done a great job to help facilitate that.
Well, I think Pennsylvania and Philly and Pittsburgh, sort of two bookends of the state with different, unique, and dynamic innovation communities. I think they're clearly on the map, and I'm taking a big step forward. And I think that, like I said, in the post-COVID world, there's a tremendous opportunity, maybe relative to where we might have been 2 years ago. So I think sort of all signs point in the right direction, and there's a lot of proof points and breakout companies that are putting Philly and Pittsburgh on the map.
Well, I'm glad we brought Pittsburgh into the conversation, because Peptilogics is based in Pittsburgh. And as the head of portfolio strategy and development there, it seems like you're going to be right back doing what you were doing, expanding, building, innovating. Let's talk about Peptilogics and your move there.
Well, throughout my career, no matter where I was, small, medium, large, or extra large companies, I was always about what technology is coming next, and how can I shape both the ideation and creation, but also the development and commercialization. As a clinician, I'm committed to bringing the best clinical technologies to transform the care of patients, and for the patients and by the physicians. So to do that, Peptilogics, I think, is really revolutionizing the way the world's going to see peptide synthesis development and clinical solutions that come from that. We really have two exciting halves of the company: a computational AI-based peptide synthesis that should streamline and really drive efficiencies in drug discovery and development. The other half is actually the half that I drive, which is about driving those clinical pathways to market, driving development and clinical trials, and the commercialization of multiple platforms around peptides. Originally, our starting spot is around anti-infective technology. Why did I think Peptilogics was a breakout company? I think a great leader, a visionary CEO, Jonathan Steckbeck, building a great team. He's got a very exciting board and set of investors, including Teal Capital and our partnership with Carbex. And then the team that we're building right now, we've got a lot of momentum in Pittsburgh, and we're excited about what we're able to do there. We're looking at headquarters right now, and it's really a great time to build out the company. And I think we're really going to change the way the world sees peptides, and hopefully we're the next generation leading that effort.
And as far as your position there and Peptilogics, how do you see integration with the leadership in innovation at both Carnegie Mellon and at UPMC, more on the drug development side? Because you're kind of working both sides of that. It's a fantastic, in a sense, the thesis of your company is so perfect for the Pittsburgh cluster.
Well, if you think about the two halves, right? The drug development side and the computational AI, drug synthesis design and development side, to have Carnegie Mellon, a leader in robotics and AI technology, and to have the University of Pittsburgh and UPMC as leaders in research and clinical delivery. I think both sides of that coin are really perfect for Peptilogics and what we're trying to build.
So let's come back to the broader context. We've talked about Pittsburgh, we've talked about Philadelphia. Let's talk about the Commonwealth for a second, and how that factors into what's happening on both ends of the state.
Yeah, Pennsylvania, and I've seen a lot of innovation ecosystems around the world, and I look for 4 or 5 key elements. What is the academia and scientific technology component? Is there clinical expertise? Do you have entrepreneurs and executive talent that's available? Does the government have a plan of robust nurturing and building the right incentives and infrastructure to do that? Is there an investment community? Are people going to fund these things? I think Pennsylvania checks a lot of those boxes clearly on academia, science and technology, on clinical acumen, on strategic players with lots of executive talent available. I think there's some work that we need to do on driving that comprehensive government support plan which I think it's trending in the right direction, but there's probably a little more work still to be done there. And making it having enough infrastructure to, as we said earlier, attract entrepreneurs, keep entrepreneurs, and have entrepreneurs from other areas come to Pennsylvania. I think Life Sciences PA is doing a great job of helping drive that. I see it, growing exponentially every year, those opportunities, but I think there's still some work to be done.
Well, Nick, we really look forward to watching how your growth develops and Peptilogics' future. Congratulations again on the Series B financing, and we look forward to talking again soon.
Thanks, Joe. I really appreciate it. We'll hopefully have a good story to continue to tell you again soon.